Good day everyone, my name is Dr. Olivia. I'm a consultant in the NHS in the UK, and I talk about life as an international medical graduate who's gone through all the different stages to become a consultant in the UK. Now, I know I haven't filmed in a very long time, and I promised myself that I would only come back when I've learned how to edit and film properly on YouTube. However, there was a very special reason that I had to come on today. It is interview season. There are IMT interviews coming up, there are registrar interviews coming up, there are consultant interviews that are always happening. But because most of this week there are many people doing IMT interviews, I thought I'd do a short, quick video about the pros and cons of various methods and how to approach the IMT interview overall. Okay? What I would say primarily is that there are no hard and fast rules. You may practice, you may pay lots of money from different courses and different teams and saying, go with this direction, go with that direction. There are no hard and fast rules. However, and I say a big however, the main thing is that you come across in a manner that shows that you are treating patients safely, that you are treating patients confidently, and that you are working as part of a supportive team to ensure the best patient care possible. Okay, that's the main focus that somebody just wants to see as you progress in your career, that you're moving from a foundation year level into a level where you may be supporting more junior members of staff, and within yourself that you're comfortable enough to make bigger decisions for those patients. Right, so I'll start off with, it's only about a week before your interviews, most of you, so most of you would have already practiced, but just to go through some of the basic points and to make sure that you've got all of these things sorted. Now that the interviews are being done virtually, please make sure that your internet connection is well set up, that you've got good signal, that your microphone is working, you've got a good camera, because you wouldn't believe some of the very, very good candidates on the day, they've got Wi-Fi issues, internet issues, and unfortunately, people may have to try and go back to them, and it just throws off the entire interview. So just having that set up is absolutely mandatory. The second thing is to ensure that you keep your spirits up, you keep your enthusiasm up. Some of you have been practicing for weeks, months, some of you haven't practiced very much, and that's still okay, especially if you've been an experienced doctor for many years. Most people would have at least 2 years of medical experience before they do this interview, and some of you may have more than that, 4 or 5 years, some people even 10 years plus, depending on detours or things that may have happened during their life. So you can use your experience as a crutch, sort of as a background to give you that confidence boost. But even if you've practiced a million times, on the day, what the interviewers want to see is that you have a genuine interest, that you're not completely rehearsed, and that you're answering as truthfully and as genuinely as you would do in a real life scenario. Right? So the interview, as most of you would know, is now structured into 2 scenarios, 2 sections. The first question being based on your portfolio or your CV, and then going more into details about why you want to do IMT, and then having an ethical scenario, governance scenario, and the second question is based more on a clinical scenario. Right, with the first question about your portfolio, you're expected to present your portfolio in 2 minutes, and I would say to still try and practice going through your portfolio with whatever acronym that you've found. There's CAMP, there are different ones, just to give it a bit more structure and knowing what you want to highlight. I think it's very important to highlight your achievements. How you do that and how you talk about your achievements is very important. It's not just a matter of saying, I was the first person in my year and I did this project. The main things about highlighting those achievements is to also show that you would be qualified to do more of those things in your IMT year. So when you highlight achievements, especially highlight areas of leadership, areas of management, areas of research, areas of leading in education, for example, just to show that you are able to progress in your IMT career. And when you talk about a project, don't just mention the name. You can say what the impact was. For example, if you're talking about a quality improvement project about a particular group of patients where there was a specific need, highlight how their lives were improved based on the project that you did, or how patients' lives can be improved based on the work that you are doing. If you have a particular subspecialty in mind and you've done work around that, and that could lead you down the path of post-IMT higher specialty training, you can highlight that, but just to remember that whatever you include, just that they will ask you a lot more questions about it, or they may ask you a lot more questions about it. In that first question, most times they will also include an ethical or a scenario around governance. So a colleague is late, a colleague is drunk, patient wants to leave home, relatives it's been tricky to have conversations. There's a scenario where you need to escalate things like that, drug errors. Just going back to the basics, remembering that patient safety is always first, trying to support patients and colleagues as much as possible. So trying to speak to a colleague if they're going through a difficult time first to find out a bit more information, escalating to your superiors when necessary, but always thinking about things like capacity assessments when those are needed for patient decision making, involving the full MDT approach, very important in many complex scenarios where there may be difficult discussions with patients or families. In phases or datics or incident reporting, very important. Checking on trust guidelines for unknown circumstances, making quality improvement projects or audits around situations where there may have been lapses in care and how to improve that. For the second scenario, for the clinical scenario, mainly it's about very common presentations in hospitals. So what I've encouraged people to do is read the Oxford Clinical Handbook. You can't read the whole thing, but the emergency section at the back with the common scenarios, just know these and know your trust guidelines as well. If you currently work in the UK, if you don't currently work in the UK, to read the basic management of those emergency scenarios and have an idea. And you can always incorporate the fact that you can check trust guidelines as it relates to a particular management plan. So things like seizures, respiratory COPD, upper GI bleed, lower GI bleed, having basic knowledge of the basic situations that arise as a doctor on call, maybe from your FY2 doctor or an emergency doctor, or just having to go and see a patient that's acutely unwell. Not forgetting your A to E approach, again making sure that patients are safe, staff are safe, and highlighting basic management plans in a confident manner. Now, if you're doing well, the patient may deteriorate and you may have more things to do after you've done your initial assessment of your A to E. You've got more background from the family or from the team with regards to the history, what the likely diagnosis is, and you've started some treatment plan. Patient may stable, but then at some point they may deteriorate further, and so you need to know your ALS guidelines in and out, CPR, and what to do next and when to give various medications. With the handover, you use the classic S-bar approach. Hello, my name is Dr. John. I'm the IMT one on call, and I've been reviewing this 78-year-old lady who's got what is likely euvolemic hyponatremia, and she needs some further investigations as part of your shift. So her background is that she's 78. She was previously at home having medical management for conditions X, Y, and Z. She's currently taking these medications, which we think may have contributed. She's had these investigations as part of her assessment, and so far we found out this is what her blood tests look like. When she comes to you as part of your management, can you kindly follow up her urine osmolality, serum osmolality, etc., etc. Okay, so just basic S-bar approach for any patient, and ensuring that all the relevant details are passed on. And that's it. So that's it. I make it sound like it's an easy interview, but it's only half an hour. So it's much better than it could be. You have to take it upon yourself to try and practice some methods to try and bring down the nerves as much as possible. Going into the interview knowing that you're a good doctor, that's the main thing. Understanding that with your experience that you have what it takes, not trying to impress the panel, but simply showing the panel that this is what I've done, therefore I know that I'm a good candidate to do this job. You know, you're not asking them to please, please, please. You're saying, I deserve this job because of all the things that I've done. And some people, because of, you know, anxiety, perfectionism, you want to get everything absolutely 100% right. And if you miss out one thing in the interview, one thing in the management, one line, one drug, one dose, you beat yourself up about it. A lot of people are still in the habit of self-sabotage. You're addicted to that high, or rather that low that comes when the anxiety is too much, or when you've answered in a particular way that you don't feel is 100% what you could have done, and then you go into the next station or you go home and some people cry and some people beat up themselves so much about it. But it's almost like some people's bodies and minds get addicted to that mindset. Like you almost have to do something to put yourself in a position where you then get upset about it. So trying to stop that cycle of that self-sabotage and recreating that up and down of that stressful hormone situation, you need to do it at least before the interview day, because you cannot self-sabotage on that day. There's absolutely no way that that feeling of wanting to do something or say something or missing something out, and then taking all those negative emotions into another station, like, it won't be helpful. It's never helpful. It's just something that people have gotten accustomed to because of perfectionism and anxiety. So whatever you need to do the day before, the night before, make sure you get a good rest. And even if you don't get a good rest, still, you will do well on the day. Okay? You will do well on the day. You've been a good doctor. You've been in clinical scenarios. If your mind goes blank, just think about what you would do in that real life situation and say that. So I wish every single one of you a successful interview, and for those who have practiced with me, I wish you an extra special interview and all the best. All my love.